Hello, ladies and gentlemen, and welcome to another exciting episode of Global Healthcare Heroes, where we celebrate one hero at a time. Today, the hero we are celebrating, his name is Mr. Darion Arende, and Darion is a pharmacy technician, a compound pharmacy technician. He has completed his bachelor's in healthcare administration, and we congratulate Darion for that. And Darion, we welcome you to our show, and thank you for allowing us to celebrate you as a healthcare hero. Welcome.
No, thank you very much, Manjeet. It's a privilege to be on the show and be a part of something that is in grassroots, and looking forward to being a part of it for many years to come.
Absolutely. Thank you so much. We want to ask you what led to this journey, about you decided that you want to join a healthcare. So what was the beginning?
Well, at the beginning, I was very interested in being a cardiologist. A young guy, I thought I could whip the world take it by its tail and just whip it the way I wanted it to bend. And it took me years to find out that it doesn't quite work that way. So got into nursing after that, and finished my third year in nursing. And then I realized, well, I've got to finish it, but the school I was at didn't have a program where I could just get my BSN. And then I got sick, but I didn't stop wanting to be a part of the healthcare and the healthcare system in some form or other. And then about 13 years ago, I went to a small little community college in Ohio, and they offered a pharmacy tech compounding or pharmacy tech program. And I went there and I enjoyed it because I've always loved math and chemistry. And it also, again, got me back into the healthcare field. And once I got that, I looked at what is there within the pharmacy world that is a needed commodity. And I found very fast that it was for compounding. Many people know that the regular pharmacy tech, either at the over-the-counter retail pharmacy, and that's what most of the people think a pharmacy tech does. The field that I'm in is very specialized, but it took me years to get to where I'm at. I did just regular compounds, capsules, solutions, and oral stuff, but where I'm at now is exclusively oncology or chemo and chemotherapy drugs. So it's a very specific niche within the field of oncology or healthcare, and it's a needed commodity, very much needed.
Yes.
As we see, people are suffering with other diseases, yet the one constant has always been cancer. It's always been there, and it's always taken lives, and I've always wanted to be a part of a group or a team or a company or an entity to see if there's something that we could do to either help ease the pain and burden of the patients that are suffering, and they do suffer every single day. I have an compromised immune system, and I can identify with them when they come in and they weak, and it just breaks my heart, because now I'm like, well, I'm in a position to where I can work with the doctors, I can work with the nurses very closely with both to ensure that the patient gets the best of the products that we have available. And then many times, as in healthcare, there is a loss of life, but we also celebrate the victories that we get one step at a time with the full recovery of cancer patients. And, it's just a blessing, truly a blessing to be a part of something that big. Yet you're just a small part in a very, very big world.
Yes, no, I agree. And glad you're feeling better now. And
Yes,
and again, congratulations on completing your your bachelor's in healthcare
Yes.
administration. Now, what led to this journey?
Well, the journey was based on, because of my age and because of the other setbacks that I've had with my health. It was either going to be I can go to pharmacy school and complete my PharmD, or I can get my bachelor's and then do my master's. And then obviously the biggest concern then would be cost. And the bachelor's, the health administration is a very cheaper way to go, where I can still be a part of a healthcare system, but I can effectively affect the type of care the patient gets from a legal perspective, from where you don't fight with the health insurance companies, but you kind of coerce them into treating, because cancer patients in this current um, economy or healthcare system here in the United States, they do not have full coverage. I've worked, like I said, in other fields within compounding, where I've seen ED drugs covered by insurance. Cancer compounds don't get covered 100%. A lot of times the families go to extreme lengths to secure just the payments to get their family members treated or even themselves. And this is where I want to be a part of developing something where we can work with the insurance groups, but also be more toward the patients to see if there's somewhere we can connect where there's not such a big, huge loss on their income or impact of their well-being while they're still here on this earth.
Well, so Darion, I truly wish and pray that the desire of your heart will come to the completion very soon, and you will soon be able to do what you really want to. And I wish you all the very success in that. Now I want to touch base. So masters is your next step.
That is my next step. Yes, that is my next step.
Wonderful, wonderful.
And the reason for the masters is so that a lot of positions within the healthcare administration requires at least a master's so that you can be a director, which gives you a little bit more leverage, a little bit more influence on policy to work, how you can make it to work or make it work better for the company that you work with or for, and then also other entities, outside vendors. They tend to have a better demeanor toward your suggestions, as in a director's position versus just the, not to belittle the position that I would be getting as a health administrator, but with that, there's a limited authority. With a director, there's a little bit more authority.
Absolutely, absolutely, yes. Now, so you did mention Ohio. Ohio, the state of Ohio, is that where you were born and raised?
No, that is not. I was born and raised in South Africa.
Oh, okay.
And I moved to Connecticut and had a small family business there. And then we moved to Ohio just before 9/11. And then we moved to Texas, where I had my surgery. And here I am.
Sir.
Through a long walk to freedom.
Are you close by from Cape Town?
Yes, I lived in Cape Town. It was in a little small town called Belhar. That's where I grew up.
Wonderful.
Many things that I can remember from there.
Now, sir, moving to our next question. I'm sure you're aware of the global problem that we are facing,
yes.
Which is the shortage of a healthcare workforce.
Yes.
Any suggestion you have that what should we do, not only in nursing, not only in medicine, but in totality? It's not only in the United States, but it's globally. So what are your thoughts? What should be done?
Well, from my perspective, there is, because of the shortage, I think it's more because of governments in a lot of, and this is where I speak of governments in Africa, because I grew up in South Africa, so I saw the lack and there was for healthcare workers, but also the lack of necessary supplies, adequate ability to take care of your patient, adequate ability to perform certain surgeries, needed surgeries. There was a lack thereof. In the United States, there is an opulence, but there's a lot of bureaucracy. So there's just, how do you find that middle of the road where there's enough for the doctors and the nurses and the pharmacy staff to do what they need to do? And then how do you grow the staff itself? um, I think should be one of the issues that we have to, because a lot of times, if even if someone is in a position where they get paid a lot of money, they don't stay around long enough within a company because they're always looking for the bigger cut of for income. Which, I
Right.
mean, it's just capitalism at its best, and that's fine. There's nothing wrong with it. But where do you draw the line between what you need to really do for your patients versus what your income level is? And again, that comes with where you live, obviously. From my perspective, where I'm at in the little field in pharmacy, I have this uh, decree within my little outpatient facilities. You come to work because you love
What you,
what you do
yes.
and who you work for and with. And
Beautiful.
that pushes our team to do above what we would be expected. We go beyond the one phone call. We go beyond just saying, okay, goodbye to the patient when they leave the door and we forget about them. We have follow ups, we have outreach. We become almost like a family to them. And when people are suffering, that's what they need. Someone to either call and just talk to, or someone to just say, "Hey, how are you? You know, how did the treatment go?" Stuff like that. It's more personable. Some. Like I wouldn't say going back to where the doctor would do house calls or house visits, because in today's platform, we have another means, and that's the internet, which can be used to an enormous advantage. Again, and trying to address the global effect of the shortage of healthcare heroes in today's healthcare crunch that we have and the pandemic. It just shows where we are. You know, granted, not everyone wants to be in healthcare. Not everyone loves what they do in healthcare, and it's not for everyone. Um,
True.
how to address it? How to it's one step at a time, but you have to identify within your community what is needed. And I think growing it from the grassroots of your community and pushing it through as a model, if that model works, other societies can adapt or adopt it. And then maybe one day it can be a global type of adoption to make it work where healthcare, insurance, patient care, which is the number one key right now in healthcare,
True.
becomes the first format that everyone looks at. That's like a package.
Right, right. Finding the happy ground
Exactly.
is the key.
Exactly.
I
Finding a
completely
happy
agree.
medium.
Absolutely. Well, sir, if you have this opportunity at this time to convey a message to the fellow global healthcare workers, what that message would be.
You have done a fabulous job.
Thank you.
Don't ever think that you've not. Curbing what we currently face, or trying to curb what we currently face, you've done your little part, and it's showing. You maybe cannot identify with it immediately, but it is a small bit. If you look at where we were 3 months ago when things started out in China and where we are today, yeah, we do not possibly have a guaranteed vaccine, but we're on the way toward it. And with what you are doing as far as keeping yourself safe, you're now also keeping others safe. just by PPE, and just taking care of yourself. And you also, I want to, even Brother Manjeet, I want to salute you. You
Thank
are in the healthcare, you're on the forefront, you're one-on-one with patients. And you taking care of yourself is absolutely important. And you're doing a marvelous job with even this platform by getting the word out to others that, hey, you're not forgotten. You're part of a team, a global team.
Absolutely. Well, thank you. Thank you very much. And at this time, I would like to draw all the attention, all the focus to you. And that's thank you so much for all what you're doing. Yes, you said you are a very small part or a piece of a big picture, but please know if you are not there, that picture will not be completed. So you are a very important part of our healthcare, and we want to celebrate you as a healthcare hero at this time. And that's my prayer, that may God continue to bless you as you touch many lives in the days to come. And oncology is one of the department, you know, like I've, as a nurse, I have taken care of oncology patients, and I know that what you go through every day. And again, my prayer is, may God continue to bless you, bless your family, and continue to keep up the very good work that you are doing. Thank you very much.
Thank you very much, Manjeet. I appreciate it, and thank you again for this platform that you are using. It's definitely something that is usable for now and for the future, because if there's not a voice, at least your voice is being heard right now.
No, thank you. And to all the viewers, all the listeners who are watching this video, please do like this video. And if you have any question for Mr. Darion, please go ahead and post your question in the comment section. And if you have not subscribed to the channel, please do so. Do like the video. And like I always say, if you are in healthcare, you are a hero. Until next time we meet, take care. Thank you.